What is Hashimoto's? There's a lot of conversation out there. I want you to join Dr. Red and myself to learn all about this disease and problems that can be caused by your thyroid, here on The Younger You.
I'm on top of the world, now I'm living, and the good just gets better, keeps it giving. Not even close to the end, it's just beginning. Life is getting lighter while the days are getting brighter, yeah. And it's a good, I won't even worry anymore. Took all my cares, still can kick them all out the door. Go on and try, come and tell me what you're waiting for. Move and keep them going till your life is overflowing, yeah.
Welcome to The Younger You. The exact cause of low thyroid disease is not known, but many factors are believed to play a role. I want to introduce you to Dr. Red, who specialises not only in low thyroid, but also Hashimoto's. How are you, Dr. Red?
Good, how are you doing?
Well, I want to talk to you a little bit about what is a low thyroid to begin with.
Okay, this is when your thyroid will not produce the life-sustaining thyroid hormones that your body needs. And this is crucial because your body uses thyroid hormones in pretty much every single aspect. And so every single cell in your body has a thyroid hormone receptor. So thyroid hormones are crucial.
Okay, well, what are the symptoms?
Well, depression, fatigue, inability to lose weight, they'll even end up having anxiety, restlessness, insomnia. Oftentimes people with low thyroid will also struggle with intestinal issues as well.
What are the main causes why people actually have a low thyroid?
The number one cause is a disease called Hashimoto's disease, and this is where your immune system, instead of attacking bad things, starts attacking its own tissue. And it will destroy the thyroid tissue at a rapid pace and eventually cause a permanent low thyroid. So really, it's not a primary thyroid problem that's the main cause. It's actually an autoimmune condition.
Can I ask a really silly question?
Yeah.
Where's the thyroid?
So the thyroid is right here, right in the middle of the neck, and it's kind of like a butterfly shaped.
Okay.
But that's the main organ there.
What are the proper tests to do regarding your thyroid?
Most doctors will run what's called a TSH, thyroid stimulating hormone marker.
How do they run that?
Through the blood
tests?
work. Yep,
okay.
through the blood work. They also run a T3 hormone as well, if you're lucky. But it's also important to make sure that we're running for the antibodies, because remember, Hashimoto's is the number one cause of low thyroid, so checking to see if you have this disease is crucial, and it can change the prognosis and outcome of care. So that test will be a TPO antibody, which is a thyroid peroxidase antibody, okay?
Yep.
And then also an antithyroglobulin antibody as well. Those two markers running in conjunction with the TSH and T3 is a necessity.
Would your normal GP run those tests?
No.
In a normal blood work?
No, and even there's a lot of endocrinologists that won't. So making sure that you be proactive and just have your doctor run those to be safe is crucial.
Is Hashimoto's genetic?
What will end up happening is we'll have families that will all end up having Hashimoto's.
Really?
And what's interesting that we're seeing now is that it's about a 9-to-1 female to male ratio. And so
Wow.
if the grandma has low thyroid, then most likely the
daughter.
mom and the daughters will end up
Wow.
having Hashimoto's and low thyroid as well.
Why more in women?
Well, the research is showing that the number one cause of this onset autoimmunity is due to increased estrogen levels. And so obviously females are more likely to have estrogen surges and things like that. And so we're thinking that turns the gene on, and then once it turns on, then the autoimmune response starts destroying the thyroid tissue and causes a permanent low.
Before we learn about the treatment options out there, Dr. Red, you want to introduce us to someone that you've been looking after?
Yeah, we have a mother of two, her name's Karen, whose life was taken over by this disease.
Okay, let's take a quick look.
My name is Karen Durfee. I'm 30 years old. I'm a wife and mother of 2 boys. One is 4.5 and one is just turned 2.
Okay, so what was the heaviest that you were?
About 190 pounds.
This is baby fat before or after, or just...
Just kind of my steady weight for quite a few years.
Did you know why you were overweight?
No, I exercised regularly usually and ate well, and I could not lose. I could always lose a couple pounds, but then I always gained more back.
Was this something that you had most of your life?
No, it really kind of started right around when I was 20. I started noticing weight gain with college, and then just marriage and everything. It just started piling on, and there wasn't anything I could do to get it off.
So when you were told it was Hashimoto's, there was a name for it. There's a disease called that. There's a cure for that. What went through your mind?
I saw that other people were feeling better and losing weight and happy, and I knew I wanted it.
Talk us through some of those symptoms.
The biggest one was fatigue. I was so tired. Both of my boys napped, and if I didn't get a nap while they napped, the day was just over for me.
Were you depressed?
That kind of started coming right before I went in. and started getting help. I didn't know that that's what it was. I had never experienced it before, but I've been told that that's what I was going through, was depression. I had no desire to do anything, couldn't get off the couch, I couldn't play with my boys. I was just completely just run down.
Had you been to a GP?
I went and saw an endocrinologist, and he just said, yeah, you have Hashimoto's. That a lot of people have it, and your levels look good, come back in a year. And I was devastated.
My thyroid is in my body, my neck area.
It's up here, and I'm not sure what it does, but I know it's up here.
My mom has thyroid cancer, so it's right here within the neck area.
I used to have a hyperthyroid, and I had to have thyroid medicine because I was always tired.
Coming up after the break, Dr. Red is heading over to the Intermountain Medical Centre to find out more about our thyroids. It's giveaway time once again on The Younger You. You could win an opalescence whitening kit from Ultradent, valued at $250. Be sure to head over to theyoungeryou.tv/contest to enter. The following footage contains actual surgical procedures. It may be too graphic for some viewers.
Okay, we're here with Dr. Aaron Krantz at the Intermountain Medical Center. He has loads and loads of experience treating thyroid patients. And so, Dr. Aaron Krantz, thanks for having us. What are some nonspecific symptoms that patients with thyroid will suffer from?
The symptoms of thyroid disease are invariably nonspecific, and they can range from everything from hair falling out, nails breaking, problems swallowing bread or meat, choking when you're laying down, discharge from your breasts. I can go on and on.
Wow. Now, I know hyperthyroid can be a very serious condition and needs treatment right away. What are the complications if those patients don't get treatment?
If a person has untreated hyperthyroidism and is given a large dose of iodine, for example, for an X-ray procedure, that can precipitate a condition called thyroid storm. And thyroid storm has a fatality rate in excess of 60%.
I actually had a patient with that same thing happen. She had the IV contrast, and immediately she went into like atrial fibrillation.
Yes.
They had to life flight her out, and it was a pretty scary situation. So.
Yes, fatal disease. That is totally avoidable if you know you have a thyroid problem. 10% of adult Americans have thyroid disease.
Why is it that somebody with a thyroid problem should avoid iodine?
Their thyroid is exquisitely sensitive to iodine, and any excess iodine will shut down the thyroid, will make them become hypothyroid. Remember that you need about 15 micrograms of iodine a day, which is a very, very negligible amount. So when you start taking milligram or even gram amounts, or in the case of an X-ray where you're getting 35,000 times the amount of iodine that you need, it really will wreak havoc on your thyroid
flare
gland.
things up like crazy.
The most common form of hyperthyroidism is called Graves' disease,
Graves' disease, yeah.
which is named after Dr. Graves, who was an Irish physician. Graves' disease, one of the manifestations is that the eyes become very prominent because of swelling of the fat behind the eyes. And oftentimes, one eye is more prominent than the other.
Why is that?
So what I love to do is when a patient comes in, the first question I'll ask them is, I bet you sleep on your right side if the right eye is more prominent.
Interesting.
And the reason for that being is because the mediators of inflammation are soluble factors. And so they flow down with gravity. So if a person is lying on their right side, that's where they're all going to pool.
Yeah.
And that's why the inflammation is worse on the right side, and that's why the right eye is more prominent.
Interesting. With Hashimoto's, as the immune system is destroying the thyroid at a rapid pace, and that creates nodules, does that turn into cancer?
So there is an increased incidence of thyroid cancer in people with autoimmune thyroid disease. The good news is that if you have to have cancer, there's probably no better cancer to have than thyroid cancer, because it is very easy to diagnose and very easy to not only treat, but to cure.
Great. That's good news. Now, with the surgery, what are we actually seeing in the surgery? Why would someone need the thyroid taken out?
Well, the indications for taking out a thyroid are, first and foremost, if there's a suspicion of thyroid cancer.
Yeah.
And so what we're seeing in that video is a large left upper pole thyroid nodule, which apparently was suspicious for malignancy.
Yeah.
And that's an indication for doing a total thyroidectomy.
So can you explain what a nodule is?
A thyroid nodule is a distinct anatomic mass in the thyroid, and it will have a consistency that is different from normal or surrounding thyroid tissue. And any thyroid disease can manifest itself as a nodule.
Tell us about this new cutting-edge technology for thyroid patients.
So there's basically only one blood test you need to do to screen for thyroid disease, and that's to measure a patient's TSH, thyroid stimulating hormone.
Yeah.
So right now, to get a TSH measured will take a couple of days and cost about $100, and then you have to have it interpreted.
Yeah.
So what we've developed is a way to measure TSH using a smartphone. And you use a very simple disposable device, kind of works like a pregnancy test, and you put it into an attachment to a smartphone, and then you click on an app, and it's able to give you a TSH result. And this whole process takes about 20 minutes.
Wow.
And it costs a couple of dollars. So another novel solution is an app called Thyroid Pro, which allows a person, a physician, a patient, to enter in their TSH value and some basic health information. And it will, as an educational exercise, take them through what the right dose of medication for that individual person based upon that TSH should be.
That's great.
So with a phone, you can diagnose and treat thyroid disease.
That's great.
This is the future of medicine, and it really reflects Intermountain's culture of innovation.
Do you know what foods are good for your thyroid and those that are not? Well, after the break, Dr. Red is going to tell us all about it. Like us on Facebook and follow us on Twitter for updates on the show and join the Younger You conversation. It's important for everyone to take care of the thyroid, not just people with Hashimoto's. Dr. Red is going to be letting us know what foods can affect your thyroid. Then we'll be hearing from Karen. Okay, Dr. Red, I know all these things are good and bad, but how is it affecting your thyroid?
The number one cause that will flare up the autoimmunity for Hashimoto's is gluten.
But gluten's in so much food.
I know. We're finding out now that a Hashimoto's patient will be intolerant to gluten almost just as much as someone that has celiac.
How do you know within your body that you are allergic to gluten? What are the signs?
Intestinal problems, you might have cramping, you might just have fatigue. I mean,
okay.
All that will happen is that when you eat gluten, it will cause the autoimmune response to flare up and it will destroy more of the thyroid tissue. So it will just heighten your symptoms more.
So could you just to test yourself at home, just give up bread and pasta and wheats just for a week to see how you feel?
Well, it might be more complicated than that,
exactly.
But you can. You can stop for 3 months, and if that's the only trigger that you have, you'll notice a difference.
Okay. Okay, I understand. Soy milk, normal milk.
Soy increases estrogen, and estrogen will increase the autoimmunity. So if you have Hashimoto's and you're eating a lot of soy and things like that, then that could be a problem due to the amount that it will increase estrogen.
But we've always been told soya milk is fantastic for you.
Yeah. So it's not, especially if you have Hashimoto's.
Okay, what about almond milk?
Almond milk's great.
Oh.
Coconut milk.
Okay.
I would transition more to those as well.
I see you've got iodized salt here. Yeah. How is that different from sea salt?
Well, what they're doing is they're taking salt and they're adding iodine to it. And what we're finding out now for Hashimoto's patients is that iodine can be a big trigger.
Okay, but you can have sea salt?
Yeah, sea salt
okay.
has sea salt.
You're not saying cut that out?
Nope, sea salt's fine.
I just noticed over here you've got what I would call gummy bears, which are vitamin D.
Yeah, and if you're going to take vitamin D, don't eat the gummy bear kind. But what you can do and what the best source is vitamin D that you can put underneath the tongue. So it bypasses...
Oh, in a liquid form?
Yep, liquid form.
Okay.
So kind of like liquid drops.
Yes.
Put it underneath the tongue, and it will bypass the intestinal tract and go right into the bloodstream. That's the best thing that we're finding because a lot of our Hashimoto's patients will end up having poor absorption, poor digestion, and intestinal issues and all that as well.
So by having poor absorption, that you're not actually getting all the nutrients that you need from the foods you're eating.
Even if we gave them vitamin D to take orally, it might not absorb efficiently.
So stay with the liquid.
Yep.
We get them at where?
Yep.
Health food stores?
Any health food store, just get the sublingual.
People like you.
Yeah,
exactly. Okay. Spices, turmeric, love that.
What we're finding out now is that high doses of turmeric will really suppress the autoimmune response and really help calm it down. So it will increase regulatory T cells. It will decrease what's called Th17 cells, which is awesome for the autoimmunity. So anyone that's suffering with an autoimmune disease, turmeric is going to be your go-to factor.
All right, of course we've got the fruit and veggies, everyone. We know they're all good for us, no matter what.
Yes, most of the vegetables
Why
are
do
good
I
for
see
you.
a butt coming
Well,
along?
corn can also be a trigger if you're intolerant to it.
That I didn't know.
Yep. So we actually know corn's a grain. It's not even a vegetable. You know, a diet composed of vegetables and fruits can be great, but then also too, making sure that you eat every 2 to 3 hours is crucial.
Okay.
So eat like your lean meats and all that stuff as well. One big problem that we see though is that people that eat too much fruit can be just like eating Laffy Taffy and sugar.
I know, I love a banana.
Yeah.
I could eat 5 bananas in an hour.
And if you did that and you had Hashimoto's, it actually cause it to flare up. Too much fruit at one time will cause what's called an insulin surge.
Okay.
And that's also another huge trigger to flare up the autoimmunity.
Okay, you're saying that if you eat too much fruit, is there a particular fruit that you shouldn't be eating at all?
Not necessarily,
Okay.
but you're gonna have to be really careful with watermelon. Watermelon has a high sugar content, and so obviously minimize the amount of watermelon that you eat.
Dr. Ed and I will discuss some treatment options in just a little bit. But before I do that, I want to check back in with Karen to find out about what she did after she found out she had Hashimoto's. Take a look. How is the Hashimoto's taking over your life?
It took over completely. I knew I needed to start my own little business to help with family income, and there was nothing anyone could do to make me get started to do it. I literally laid on the couch for just days and watched my kids play.
Did you cry?
Oh yeah.
Did you
I was miserable.
What made you research more and realize there were people out there that actually treated Hashimoto's?
I had seen a few commercials. I have a sister-in-law that had heard of Red River, and so I just decided, I just got on the internet.
Initial consultation, disaster. Said you had it, didn't know what to do with it. Come back in a year. You did the internet, you found out what it actually was all about, who's servicing you to be able to do this. So of course you find my good friend Dr. Joshua Red, who we all adore.
Yes. Love
Okay,
it.
you go in, talk me through the system.
They went in and met with me and just kind of wanted to know about me, how my life had been up to that point, symptoms.
So like a verbal consultation?
Yes, basically. And then asked if we wanted to move into some preliminary testing, basically.
So when
some
you
blood
say
work,
test,
stuff like that.
okay, blood work, not putting little things on your head to
No,
see if
it
you're
was
mentally
all
okay.
it was all mostly lab work, stuff like that. Yeah.
Okay. How has the treatment affected our patient Karen? Find out after the break. It's giveaway time once again on The Younger You. You could win an opalescence whitening kit from Ultradent valued at $250. Be sure to head over to theyoungeryou.tv/contests to enter. Check out the Younger You website to watch full episodes of the show, read about our product of the week, and get useful tips and tricks to help you achieve the Younger You. Dr. Red will be joining me once again in the studio to hear more about this particular disease. That's right, it is a disease. Then we're going to chat to Karen to find out how this treatment has changed her life. Why is it that some people on thyroid hormone treatment still feel no improvement?
Well, here's the problem is because if you remember, the number one cause is the autoimmune disease, right? So these patients will develop a low thyroid, be placed on a thyroid hormone, but the immune system continues to rage and destroy tissue of the thyroid and also cause problems throughout the whole body as well. So it's far more detailed and comprehensive than just a thyroid problem. Now we're dealing with an autoimmune problem, and that's typically why these patients will feel little to no improvement.
What do you do to help someone?
So here's the important thing. We take everything we know about thyroid problems, we crumble it in our hands, and then we throw it in the trash, right? Because these patients aren't suffering from a primary thyroid problem. They're suffering from an autoimmune disease. And so it's important for us to get to the mechanism of why these patients feel bad.
Okay, well, can you get rid of the disease, or this is something you're going to have for the
This is
rest
something
of
they're
your
going to
life?
have for the rest of their lives. So you have to really, one, go in and help calm down the autoimmune response, but then also show them the dietary and lifestyle things that they can do to help, really keep this in check and keep it calmed down. So a big part of what we do is more education, just to really teach these patients so that they can be the expert in their own health. And don't get me wrong, these patients still have to be on a thyroid hormone, and so we'll work in conjunction with their medical doctor, endocrinologist. We have some of our great friends who are out there. But it takes, both of us to really get to the, achieve the best outcome for the patient.
But how are you doing that? Through blood work?
We do
And diet and
lots of blood
exercise
work. diet, looking in detail at the physiological imbalances, and then trying to improve those imbalances.
Okay.
So it's kind of a pretty comprehensive approach to these patients.
Dr. Red, one of our viewers wrote in this question, which I wanted to ask you. A lot of people have all the thyroid symptoms, but the tests come back normal. I hear that all the time. Is there anything else that would cause somebody to feel like they have a low thyroid?
Yeah. So the Hashimoto's, which we already talked about.
Yeah.
We have what's called an underconversion problem of the thyroid.
What is that part?
This is basically where your thyroid produces what's called a T4 hormone. Okay, 93% of what your hormones are produced are T4 hormones.
Okay.
And your body has to convert that T4 hormone, which is an inactive hormone, your body can't do anything with it, into an active thyroid hormone. Okay. So if patients aren't converting that T4 into T3 like it should, they're going to have thyroid problems. There's also called a protein binding problem of the thyroid. This is where you have protein in your body that will transport the thyroid hormones. And when it gets to that area, they might hold on to those thyroid hormones, and so your body can't use it efficiently. And that's called a protein binding problem of the thyroid.
Okay.
Yeah.
Would that be an issue if you're not eating the right foods?
Not
With
necessarily.
That conversion, it just happens.
Yep, the protein binding problem occurs due to either high testosterone or high estrogen.
Got you.
And so that's
truly not about dietary. Okay,
Nope.
it's truly about the body
The
itself.
physiological system.
Okay,
Yep.
I understand.
Yep.
Before we wrap up the show, I want to check back in with Karen to find out how your treatments actually changed her life.
Great.
Take a look. You woke up one day and you go, a breath, I feel
I have
good.
energy.
How long did that sort of
Yeah,
take for you?
really, honestly, within the first couple weeks, I started
Really?
to notice a difference.
So say 3 weeks.
Yeah, I woke up feeling like I could get something done that day.
Really? How did that make you feel? Now, I know you feel better, but how did that make you feel mentally?
I knew that what I was doing was right and that I could be even better. Like, there was just no going back from what I was doing once I knew I didn't have to live the way I used to.
If anything, that mothers out there watching this who have some affiliation with you, go out, you could end up at a doctor's office or someone like Dr. Red and goes, you don't have Hashimoto's.
Yeah.
This is a good thing.
Yeah, no, yeah,
know,
I would
or
love to
getting
not
the-
have this, but
Yeah.
it's the way it is.
The more people I talk to, like you, the more I feel that it is an illness that is undiagnosed.
Oh, absolutely.
There are lots of symptoms,
Oh,
but
yeah.
those symptoms just need to be diagnosed properly
Yeah.
and ticked off, as you said, one
Yeah.
by one.
Yeah. Yeah, no, that was the very interesting thing to know, that I was heading towards other certain illnesses,
Yeah.
but it was all because of Hashimoto's. So to address that, I was able to prevent and fix so many things that I was
for you.
worried about for a long
Good
time.
for you. Well, good job.
Thank you.
And good luck for your
Thank you.
future health as well.
Thank you very much.
Before we go, Dr. Red, any last thoughts for the people watching at home on what they can do if they're having or think they have a thyroid disorder?
So here's the thing, find and do the right test. I think this is crucial, okay?
Okay.
And then even after that, if you end up having Hashimoto's or some type of complicated thyroid problem, look for a doctor that focuses on functional medicine. He can look in detail what's really the underlying problem that's causing the symptoms, right?
Okay.
And that's what I want to get at. So
All right.
look for that.
Dr. Red, thank you so much. I truly
Thanks for having
appreciate
me.
you coming
Thank
in.
you.
Hashimoto's is the most common thyroid disorder in America. I had no idea. Affecting more than 14 million people in the United States alone. If you have any of the symptoms that we listed today, ask your doctor about a low thyroid. For more information about the show, head over to our website at theyoungeryou.tv, and I'll see you next week. Next week on The Younger You, we'll be watching a trim down as the fat gets sucked away with the good old liposuction. The Younger You set provided by Madison McCord Interiors.